And we've been working to get the word out to oncologists, certainly, all the oncology community. We also have worked through places like Gilda's Club, because anywhere that there is a volume of people who've been treated for cancer, we want them to know that we're available and to what kind of services we might be able to offer to them. At Lawrence Hospital Center, we are not charging for this program, and so we've always, since we started, we've been available to whoever wanted to avail themselves of the service.
And for an unlimited amount of time?
You mean, as you know, the service involves a consultation with myself, which actually is a fairly lengthy consultation. It's about an hour and a half. And then the development, and these are two critical pieces of the survivorship service that were highlighted in the Institute of Medicine study and continue to be what the programs are built around, is that every patient who participates receives a treatment summary, which may sound simple, but right now people, when they get through being treated for cancer, they don't have a summary, and they may have had surgery, radiation therapy, chemotherapy. Many people don't even remember the names of the drugs they got, but it continually comes up because every time you're in contact with the healthcare system, people want to know if you've been treated for cancer, well, what did you get? So this is a one-page summary that is researched. We pull together records from all the treatment sources. So it's first reference summary, so it's accurate. That's given to the patient, and also a plan of care that is individualized for that patient and focuses on health promotion. This is a group of people, they've been through a crisis, had a terrible health problem, and have done what they had to do to deal with it. And the people that I've dealt with so far are very motivated. They want to have the healthiest life that they can have. So we don't just talk about cancer, we talk about what a person needs to do to be healthy. Weight management, exercise, if there is anxiety that people have, which is a very common thing, strategies we can use to help them deal with that, not just medication, but things like medication, yoga, that sort of thing. And surveillance is very important. So that's always part of
self-surveillance, or
well,
what do you mean by
surveillance? Meaning the watching out for cancer, but also watching out for things like bone health, because that's something that as people get older, you know, almost all women have some concerns about bone health.
And advocacy, because sometimes when I myself is having difficulty relating to my doctor about a specific issue, and he is not understanding, not just understanding the English, he's just not understanding my point of view. I go through Miss Stagner. I tell her, I said, would you please, at least maybe he will listen to you. And it has worked.
That sort of reminds me of the article that was in the Journal News, I think the 1st of July, when they interviewed two of the women who have been through the program. And they said both women have been cancer-free for more than a year, and both said they owe their lives to their doctors and their self-confidence and healthy outlook to the Cancer Survivorship Program at Lawrence Hospital. Now, what is the magic that you all do to, you know, I know that the program is for men and women, but we're sort of sexist in this program, focusing on the women. So when women are in the Cancer Survivorship Program and they've have just gone through treatment for a cancer that ravages the those parts of their anatomy that make them women, that is breast cancer or uterine cancer, ovarian cancer, cervical cancer, such as it is these days. What can you do to empower them, to restore and rebuild their self-confidence? You were talking about advocacy. What more is it?
No, Ms. Stagner makes you comfortable. She makes you feel comfortable, and you gain her trust.
Mm-hmm.
So when you gain a person's trust, you can discuss everything with her. And I'm more comfortable maybe going in depth with her,
mm-hmm.
with my problems,
mm-hmm.
maybe than with my doctor.
Mm-hmm.
And she also provide time, or at least she focus on you at that moment.
Mm-hmm.
So she helps you through what is happening,
mm-hmm.
maybe at that moment and for the long term.
We find that patients who've been treated for cancer oftentimes might be reluctant to talk about some of the concerns or the problems they have, particularly if they're intimate or personal.
Mm-hmm.
They may think that they're the only person who has
mm-hmm.
this problem.
Mm-hmm.
They don't know who to turn to
mm-hmm.
or how to deal with it. They're not sure if they should bring it up with their doctor.
Mm-hmm.
Sometimes their doctor's not comfortable talking about it because it might not be an area in which he or she is an expert.
Mm-hmm.
And the survivorship assessment is a way to open those doors
mm-hmm.
and explore whether people have those concerns. And
mm-hmm.
if they do, we have expertise to provide for those specific problems, or we have resources with whom we can connect patients
mm-hmm.
to get the help they need
mm-hmm.
for managing those issues.
You touched a little bit on what I certainly have heard from people that I know that have had cancer, the fear that they're not going to regain control of their lives, and that sounds to me like what you all are going through as a group.
Yes.
What is are the implications of the fear? How does it show up, and what do you do about it?
Are you talking about specifically the fear? The fear is somewhere, but you just have to have the courage to say, I believe in destiny. I keep saying to people, I said, I believe in destiny.
Mm-hmm.
And I am not going to be too bold to say I'm happy I had cancer, but it has opened my eyes to too many. I have met most good people through this journey. I've been doing good things and I feel happy about it. Even my work as a clinical social worker,
mm-hmm.
I'm enjoying it even better now.
Wow.
Yes, since cancer, post-cancer, I'm even enjoying my work with patients more now
mm-hmm.
than I did. It was just a job.
Mm-hmm.
Now it's not.
But the fear, I think, in getting to that place of confidence and feeling strong, it is an evolution. It certainly doesn't happen just like that.
Mm-hmm.
And some people are able to move in that direction through their own power, their family, the associations that they have. And many people, though, need assistance and guidance. I hope I'm certainly able to provide that to some extent. And also the groups, and I think that Alberta made reference to this, when the people who are in the groups share with each other
mm-hmm.
and they realize that those feelings that they have, that they may feel like, either they shouldn't have them or they shouldn't let anybody know they have them because they don't want people to worry or something like that. When they can share that with each other and gain the knowledge that this is how I cope, this is what I do, and maybe it doesn't work for everybody, but it's a possibility. It's something that somebody...
blocks,
Right, exactly. So I think that the people themselves are a huge strength of the program. And the one-on-one consultations are very, very important. And I think working in combination with the group efforts, that's where people really get the strongest benefit, is through utilizing our service, but also utilizing each other.